Buddy, and welcome back to the Only You after a couple weeks off. Dr. Pino's been traveling, doing some things, and enjoying his family. Dr. Pino, welcome back. It's good to
Thank you
see
very
you.
much, Vince. I mean, I actually have missed being here and have a conversation about different topics in mental health. And we have selected one for today that I think is very up to date in terms of what we're dealing with, especially our recent crisis of depression and suicidality post COVID. So try to get a better handle on the emotions associated with issues like this, the misunderstandings of what suicide is all about, um, and the patterns that we see in terms of both the close people to the person who's died in terms of grieving and the sense of guilt and responsibility that happens in things like this.
Well, it's interesting you said that. I sent you a link here locally in our neck of the woods. There was a suicide at a shooting range, and I
Mhm.
know some of the really good kids who work there. They rented the gun to the person through the proper channels, the way they do with anybody who comes in. And the gentleman on the range, I believe, shot a couple rounds and put the gun to his head and ended his life. And these 20-some-year-old kids had to. Some of the range officers out there, and of course the older managers on site, had to deal with that, and it's very traumatic. They have feelings of responsibility because they were interacting with this person, wondering could I have stopped it, all these things that go through people's heads. So I guess, doctor, really that's the question: is number one, are there ways to recognize somebody who is you know thinking about taking their own life, and b, what are the realities of that? Could people have prevented it? Was there a way to do something different, or is it just how it is?
Well, I've been doing this for 35 years, and I've been seeing suicidal patients since my training, probably 38 years, since 38 years. So I think that nomenclature and how we label things becomes important. And we tend to use terminology like suicide prevention, right? And when we use words like suicide and prevention together, it means that we are able to prevent, right? But prevention in the medical psychosocial sense doesn't mean eliminating the risk. What
Mhm.
it means is reducing the risk, right? Now, you were talking about this incident at the shooting range, and it becomes important to understand the different circles of trauma, right? And the closest risk of trauma is for those who are closest to the victim, right? Now, we need to understand that for somebody to get to the point of putting a gun to your head and shooting it is extremely rare and difficult to do.
Mhm.
Okay, just to give you an example, we have um, probably 500,000 people that die in the United States from diabetes and heart disease. We get about 40,000 suicides in this country, right? A good percentage of those are under the age of 35. Now, if you look at the difference, it's about the number of suicides compared to heart disease, diabetes, and non-illness. It's about 10%,
Wow.
right? So it's not as frequent as we think. Last year we had 100,000 deaths from fentanyl overdoses, right? Most of which were not intentional suicides, were accidental overdoses on fentanyl. So, and those numbers have remained pretty constant, 35 to 45,000 per year for a long time, right? Right now, we're having a crisis of increased hopelessness, depression, mostly with younger people, but there's also a high suicide risk in older people. So, age becomes a factor of risk, right? But just like age becomes a factor of risk for you to have a motor vehicle accident, right? It doesn't mean that we're going to stop everybody from the age of 15 to 25 from driving or 16 to 25 from driving because they're a high risk for an accident. But we have to recognize the risk, right? Now, on people who have mental illness, we have a higher risk. So you have somebody, and I don't know any of the history of this victim from suicide. Um, we have to recognize and understand retroactively if there was a history of mental illness in the family. And that becomes interesting for us, but also for the rest of the family, because risk is not purely um, social or psychological, it's also biological. So people that have a history of mental illness, people that have um, a history of substance abuse, and then we add age, and then you get into psychological social issues like stress, right? Like situations where um, we're starting to isolate, right? So social isolation is another big factor. So what I always tell parents, because I deal mostly with adolescents, is you have to look for sudden changes of behavior. Something that was not common for that individual is changing. Okay, so what is changing? More isolation, no communication with the family, avoidance of any social interaction, sleep difficulties, and then you start seeing some aggregate issues in terms of signs of distress, right? For example, you're starting to say goodbye when there's no reason to say goodbye. You're starting to divest yourself of your properties and giving away things, right? You stop going to work. So all of those issues become risks. And then you have catalysts, right? If you have been majorly depressed for 2 or 3 months, and then you have all of the signs that I mentioned before, well, all of a sudden, your boyfriend or girlfriend or significant other decides to leave, right? That's a catalyst. That is something that increases the risk because, in the context of that individual, you have a new situation, right?
And
Now, go ahead.
it seems like those issues. I mean, those are more contextual. The people um, and for the friends and families, and evidently this person did have some mental health challenges. Um, but for somebody just interacting with them, I've had this talk before. The vast majority of people don't wake up in the morning and say, "Oh, I'm feeling funny. Let's go to a psychiatrist and deal with a mental health or mental illness issue." You see them after a trauma typically has happened. So the vast majority of people who interact with people with mental health issues or mental illness issues are not psychiatrists. They're everyday people. They're social workers. They're teachers. They're, range officers at a shooting range. How does that person who's not trained, who doesn't know this person's life history or have that context, is there any way for them to identify a person at risk?
Wow. Um, it's almost impossible for somebody at a shooting range, for example. Somebody gets there and says, I want to rent the gun because I want to do some shooting, right? There are very few uh, potential determinants of risk, right? So, for example, if you have to do a mental health background in some places, and you say that, well, the patient was recently released from a psychiatric hospital, has a history of mental illness, has been committed because of suicidal behavior, that's a red flag, right? Uh, so, what happens with suicide, completing suicide becomes a decision, right? And it's not an easy decision to make. Most of the help can happen before the decision has been made, right? I mean, it's very difficult to prevent, especially in an environment we have too many guns, so many opportunities, and guns by far is the number one way of committing suicide. Once a patient makes that decision, okay, people go almost into a dissociative state,
Mm.
right? Like if you're disconnected, once a decision is made, it's very difficult to go backwards because reaching that decision is a very painful process, right? I mean, it's a painful process that goes totally against our nature, totally against our survival instinct, right? You have to supersede your survival instinct, right? To the point that you have to say, I'm going to kill myself. Now, I have to tell you, I'm a me as a psychiatrist, Most of the people that I see on a day-to-day basis have not reached that point. Okay. And I tell my students and I tell patients in particular too who have attempted suicide, especially younger people, and in particular women attempt suicide four times more often than men. Okay.
Wow, I did not know that.
But men kill themselves a lot more often than women.
Ah, gotcha.
Right. So being a man in particular is a risk. Right. But what happens is sometimes when people have not made the decision to kill themselves, suicide becomes a way of communicating their pain. It's a way of saying, I'm hurting, I'm lonely, I'm empty. I feel like my life is not worth it. I'm not worth it to try for. That is different than the person who says, I'm going to kill myself. I made that choice. And to some degree, that feeling of desperation and anxiety and sadness kind of gets lifted. And that makes it even more difficult to identify, right?
Oh, so there may be even like a euphoric experience or more of a normalized behavior just prior to the event.
Yeah, because now you're goal oriented. You are to the point that you're going to say, I'm going to do this, right? I mean, we see people sometimes that walk in front of a car, right?
Yeah.
I mean, and when they're walking in front of a car, they don't look like they're in pain or hurting. They're not telling anybody, I'm going to kill myself. They just go and do it, right? So for anybody to be able to identify it at that point, even for me as a psychiatrist, is difficult. It is easier for people who are at the level of identifying the pain before you get to that point.
Yeah, it's interesting you say that. I was speaking to a friend of mine who's familiar with this case, and he lived in Japan for 20 years. And he said there are no firearms. So the number one way people commit suicide is jumping on a train track. He said it happens all the time, and you can never tell. He goes, a lot of times they even have the film footage, and the people have a very peaceful look on their face, or they're even smiling when they do it. Because I guess you're right that what they've done is already made that decision, and now the act is the final, completing of that task. But for those who have to witness it, and those who have to live past it, whether it's their family, their friends, or even just bystanders. Again, there were people on this range who didn't know these people and had to watch such a gruesome event. What do you have to say to them?
Well, number one, the people that I normally worry the most, and in my career as a psychiatrist, people committing suicide, I guess it would be like a cardiologist having patients with heart attacks who die, right? Sudden person dies, and then you have to go and deal with um, trying to understand it for me as a psychiatrist, but mostly try to help the family deal with the grieving associated with this. And the number one thing is that 99.9% of the time, that situation was not preventable, right? But there's a lot of guilt and there's a lot of self-questioning, right? For those who are close to the person who died by suicide. And that's one situation. That's grieving, and this probably is particularly for parents. It becomes one of the most painful experiences in life is to lose a child. It
Yes,
doesn't really
sadly, this
matter.
person's mother,
Yeah.
has been talking about that. It's very sad.
I mean, I can't even think about it. I have children, I have grandchildren. I don't even want to think about the possibility, but I can anticipate I've seen enough pain as a result of that. Because, as we say in my culture, parents are not supposed to bury their kids, right? It's supposed to be the other way around. So, just because of that, losing somebody so close to you brings a lot of questions, self questioning, you know. And it becomes very important to understand that everybody lives their grief in different ways, right? But there's no logic behind it. There's no way that you can logically justify your pain. You have to live your pain and you have to go to the process of grieving, which there's no timelines for it,
Mhm.
comes and goes. It's like waves in the ocean. Initially the waves are too tall and too strong, and they keep coming one after the other. Eventually, there's times of calmness, and then they come back because of memory. So you have to look for professional help if you're not able to handle it yourself. Um, But we also have to understand that those who didn't die survived. Okay. And for those parents who have lost their kids, I have to say, you survive the death of your child. And you need to live your life as a survivor of that and not as a victim of that. Because it's very easy to take in the idea that my child committed suicide because of me, or because I didn't do this, or because I didn't give him this, or whatever, right? And those are thoughts that you need to get out of your head if they come to your head, because you have to stay focused on the idea: how do I survive this? What did I learn from this? How is this going to make me a more compassionate, empathic, giving human being, right? I mean, we unfortunately have a tendency to become better people after pain than after happiness.
Hmm.
Happiness is really not a great experience except for the moment, right? But pain guides us for our own survival, right? And that's what we have to learn.
Yeah, as you said, I've known quite a few people who've taken their own lives. I think six to this date, but none of them in such a public forum. Why do some people choose to do that instead of in
Well,
their? I mean, at home. And I mean, this was a public place, and it maybe. I mean, I can understand that. Yeah, if it's a shooting range, they're going to get access to a firearm. But really, I mean, there is again that kind of collateral damage of innocent people having to witness this and be around it. I had a buddy of mine who ended up killing himself, and his right in front of his wife. Traumatized her significantly more than probably needed to be, and his child was in the house as well. Very, very difficult for them. But in a public place like this, why does somebody choose to do that?
well, I mean, we can get into a psychological autopsy type of situation, trying to understand how this led to this decision. What I've seen mostly, just like you said, people jumping in front of a train in Japan, or in front of a car in the United States, or deciding to jump, into with the rope in their necks and hanging themselves from a tree, or which we see a lot of that too. Um, the method, right, is not necessarily indicative of any particular issue. Um, in my experience, and I'm not sure that we have a lot of research on this, but from my perspective, I think it's more of a dissociative state of decision making, where it doesn't matter how you do it, but once you make the plan, you stay with the plan, right? Um, I I don't I don't think that we have a lot of data on um, trying to hurt somebody else or trying to punish people, or I mean, we're going to speculate a lot, but at the end of the day, um, there's trauma associated with that, right? And when we look at it from the psychiatric perspective, and we look at trauma, and we're defining like acute stress reactions or post-traumatic stress reactions to situations like this is definitely one of those situations that people around would could easily develop if they're at risk post-traumatic stress disorder. Why is that? Because the definition of PTSD, whether it's in war or whether it's in an accident, is that you're witnessing, okay, an event in which the life of somebody else is in danger, right? And if you're predisposed to that, it's easy to imprint those memories in a way that they become repetitive, and then you develop PTSD. So people who are having difficulty sleeping, who are having recurring memories, and all of this need to need to get into some professional help as soon as possible, because there are ways to try to reduce the risk of that. But the other part is that you're saying, because this was a voluntary thing, this individual, this young person, walks into a shooting range, rents a gun, shoots a couple of rounds, and then he kills himself, right? But what if somebody had been driving drunk, okay, and driving into the shooting range, and two employees get killed, right? That's a different trauma. But under the same circumstances, the reality is that somebody died. right? So we need to remove ourselves from the stigma associated with suicide, because sometimes we get to romanticize this, right? Into the why, how come he could have gone somewhere else. Well, he didn't go somewhere else. He was there, and people witnessed that. Like they could have witnessed a tragic motorcycle accident in front of the shooting range, and somebody had to walk out and see somebody bleeding from the head, and slowly dying after a severe head injury. So the way I looked at it is, uh, for those people who are witnessing an event like this, we're exposed to the possibility of witnessing a lot of things, right? The question is, what is it doing to you? How are you processing the trauma? Okay. I mean, and I understand, somebody rented the gun to this gentleman, right? And had him sign the papers. Uh, so that may make you feel that if you hadn't done it, maybe this could have been prevented. Well, a lot of things could have been prevented. The individual getting into a car accident could have prevented something like this. So we need to stop trying to find logic behind it. For us professionally and in research and all that, it's important to understand the process, how the person got from point A to point B, life history, all of those things. And people who are specialized in those things are going to be doing things like this. But the survivors need to continue being survivors. Because what happens is we already have one serious victim of this event. We don't need more victims.
Mm.
We need more survivors, right?
So really, I mean, it is, again, like you said, it's an event that affects multiple people. Obviously, the victim itself, the surviving mother and family, who have to be survivors and be strong and move on from this in some however way they can. The people who witnessed it or were interacting or enacted at the time when this occurred. Um, let's switch gears here a little bit. And if you do know somebody, if you do understand that there's somebody who's having challenges, what are the more, like you said, contextual things that we can see other than the larger things of lack of socialization? Are there any more subtle clues that we can use, or is it really just the big stuff that allows us to say that risk at all?
Most of the people who feel so bad about their lives or their feelings or their emotions, their cognition, or because they have cancer, they feel that their life isn't worth living anymore, most of the people will communicate with someone,
Hmm.
right? So it's very important that if we know people we know have difficulty socializing, people that have difficulty trusting others, that we are good listeners, right? We have to be able to build a foundation of trust, okay, within the family, that people feel comfortable telling them, I feel so bad that I feel that my life is not worth living, right? And that's actually a question I ask people all the time, right? Because I'm not asking if they want to kill themselves, I'm asking them how they feel,
Hmm.
okay? Because not everybody who feels that their life isn't worth living are going to kill themselves, but they're hurting and they're at risk of getting to that point, right? But they have difficulty, especially very smart people. I find very smart people more prone to completing suicide because they're too logical.
Hmm.
They want everything to make sense, right? And they have a lot of difficulty dealing with emotions and anxiety. So people who are depressed and very anxious, who are highly intellectual, they tend to rationalize why to kill themselves a lot more, right? They may not be acting out in terms of being angry, being frustrated, pushing people away. You know, they're not going to be trying to tell you in unconscious ways how they feel. Kids do a lot of that. Kids will fight with you, and instead of telling you that they're depressed,
Hmm.
and instead of telling you that their self-esteem is really low and that sometimes they feel that life is not worth living, right? So we had to listen, right? And we had to allow them to tell us. We had to be able to explore with them to active listening, understanding the patients, understanding the families, understanding the history of that person, so we can offer them some help, right? So families in particular, especially parents, need to be able to listen actively about this, right? Because adolescence is a quintessential stage of life in which kids are pushing you away. And if you have a need that your kids will never push you away, right, then you're going to react with anger and frustration.
Mm.
We as parents, and this is going to sound kind of controversial, okay, had to allow our kids to do anything they want to us because that's how they learn that we're consistent. I mean, of course, I'm not saying pull a gun and shoot me or slap me or anything like that. There are boundaries that need to be respected from a moral perspective. However, if we expect that our adolescent kids, and adolescents, I'm talking 12, 13 to 25, right? Not 18. There's nothing magical happens at 18. We have to take it, okay? Because as we take it and they criticize you and they reject you as a parent, right? Which is the purpose of adolescent separation, they learn, okay, that you can take anything. I mean, you still have to set your boundaries, you still have to do all of that stuff. But if we don't have that type of a relationship, right, they're going to look for that somewhere else. And my concern is that that takes into other image of risk when it comes to suicidal behavior, drugs, impulsing acting out, premature sex, alcohol, you know, running away from home. Okay, the kids are going to get your attention one way or another, right? So you might as well listen. Okay? You don't have to agree, you don't have to accept, but you do have a responsibility to listen, though.
What are the resources that people have to help them with this? I mean, we talk about this all the time. You've trained and practiced psychiatry and the like for many decades, but the average person has no clue. How can somebody who wants to make that step get a little bit more training, a little bit more knowledge, a little bit more understanding? I understand that you've been publishing some books, but what other resources are there for people?
I think it's important that people understand what resources they have, right? So the first, and I hear people very concerned about reporting somewhat they're concerned about because they're not going to trust me anymore. They're not going to listen to me. They won't want to be my friend, they're going to ostracize me, whatever. Um, when it comes to somebody else's life, okay, there's actually a 811 number, I think, which is a nationwide number for crisis, a violent crisis, in particular suicidal behavior, that you can dial, right? Is that I'm concerned about this person, right? And they will try to do a welfare check or anything like that. If it takes your friendship loss to achieve saving a life, so be it,
It's worth it.
right? Yeah. So it's not about you; it's about them. Now, if you become more interested about that, I would say that people need to research more. Suicide risk, mental illness, the importance of eliminating stigma, the importance of empathy, the importance of engagements and safe spaces for people who have difficulty. Because in order for us to be able to further reduce the risk, but I have to tell you, we have not been very successful in the last 38 years,
It
right?
sounds like it. The numbers are exactly the same.
The numbers haven't gone down very much, right? So we hope that we can get better at this. So, and there's a lot of work being done worldwide. Uh, but we're not, I mean, suicide, unfortunately, from the research and community health system is not as important as Alzheimer's or diabetes or heart disease, right?
Mm.
I mean, the resources are not necessarily there. So we have to eliminate the stigma. We have to look at support groups. Like for this mom who has lost a child, there are support groups out there for the families of people who have committed suicide, right? So from that perspective, we have to continue surviving, right? Now we have to continue surviving with pain, but we have to see ourselves as survivors and we have to move forward.
One thing that I saw that occurred when the firefighters were there and the EMS, they actually gave out packets to the people who witnessed it, saying, "Here, these are some resources for you to get some support if you need it." Um, is that pretty common on your end?
Yeah, and we have to say, because I've seen a lot of first responders over my lifetime, and I have to tell you, we forget that they're human too.
Mm,
We forget that they're witnessing trauma too. We forget that some of them are also at risk for PTSD. This is not an easy thing. People sometimes get mistaken between our neutrality and they perceive neutrality as uncaring. No, we're trained to be empathic but assertive, right? And under crisis situations, we have to act more assertively than empathic. But it doesn't mean that we're not aware of what's happening around. It doesn't mean that we're not listening. Just means that during those moments, you have to set up boundaries. But there are protocols that first responders have to deal with this. Fortunately, in the United States, but I think that it also becomes important that we recognize that anybody, whether you're a first responder, a police officer, the owner of the store, the people who rented the gun, everybody who was around is at risk.
mm. Well, I appreciate it. Once again, wonderful wisdom. Again, for those wanting to know more about Dr. Tino, click on the site, and we have some books that you now have published. I understand,
Oh,
as well as a blog.
yes, we have a blog on Medium at Laurel AP that people can join and subscribe to. I mean, we write in two languages, and we're actually preparing an article about this particular topic, and we'll probably have it published in the next few days.
Okay, well, once again, thank you. And for those of you wanting to listen to similar shows in Spanish, that is Thursday evenings, same time, same channel.
Hey, thank you.
We'll take care.
Bye bye.